Morning. Anata Monday. Even on Easter Monday, it's Anata Monday. Good morning, everybody. Welcome back. Yeah, we've done the sacrum, or the sacral plexus, which took a couple of weeks. Finally got there. I think. I think with the two sessions combined, I think it needed that. To be honest, so yeah, hopefully that makes a lot more sense. And the beauty is that the lumbar plexus that joins into the sacral plexus is a lot easier. So we've actually got probably one of the hardest bits out of the way, and then those of you that have been with us for a while will remember the brachial plexus when we got to when we got up to the shoulder. So that's another tricky area. So we're going to try and break it down again, similarly to how just did the sacrum. So, but we've got a while before we get to the shoulder. Good morning, everyone. Morning, Tristan. Morning, Sarah. And Neil. Oh, it looks like we've got a few of our regulars in this morning. Good morning, happy Easter. Hopefully you haven't eaten too many eggs. We've got a bit of a tradition in our family ever since the kids were really little, and my son's 18 now, and he still does it. We hide eggs around the garden, and they go on a treasure on an Easter egg hunt. Yeah, it's one of those where I forget where I've put them, so we've probably got some chocolate from 10 years ago somewhere in the garden. But yeah, they still get involved even now. Right then, let's just grab my arrow there. So we've got this going on. We kind of decided to, because we realised that things are a bit tight at the moment. People are struggling with getting back into the usual kind of work. We've noticed it in our clinic as well. We used to run a lot of group exercise sessions in the clinic in Birmingham, but the people haven't wanted to train together for ages, obviously, and now they have started to again. We're slowly starting to pick the numbers up again. So it's, I mean, and that's like 2.5 years down the line. So we used to run something like 15 classes a week, and we're back up to 10. But it's still, five down. So things are tough. Patient numbers are slowly starting to creep up again. So disposable income with everything else going on as well is a bit tight. So on that, we've decided to do a bit of a competition where we give one of our cadaver workshops for free. So you can there is a link on the movement therapy education page, and you can have a look for that link. Just click on there, and you enter into a draw, and it's all done automatically through this software. And I think the prize draw is at the end of May. So you've still got a little bit of time, and that's for the October workshops. So if you fancy winning a free workshop, then have a look for that. Hey, Michelle. Talking of that, Michelle entered the one in with the STA, the Sports Therapy Association, and she won. So that was the reason why she was there a couple of weeks ago. So yeah, as people do win, I promise you, it's not just a scam. We do actually select winners. Cool. So what we're going to talk about for the next kind of 40 minutes is that. Okay, so we're going to have a look at the lumbar vertebra in a fair bit of detail, and similarly to what we did with the sacrum, we went when we did the sacrum and looked at last time, so back last year, we did the sacrum and the lumbar spine together, and yeah, kind of felt like went over it quite quickly. So we're gonna, and if you've done this kind of stuff before, then we need to. Apologies, because it's going to be going over old ground, but I think that's kind of good in a way, because it's nice to go back and confirm. Oh yeah, I remember that. Oh, I've got to put this on the screen. Morning, Stevie. First Anata Monday as a pensioner. Brilliant. Welcome. Yeah, it's all downhill from here, isn't it, mate? Cool. Right then, let's get going. Let's click on that one. Cool. Okay, so lumbar spine then. So it's often with the with different regions of the body and different tests and things like that. They're often abbreviated, especially in physiotherapy world. And the lumbar spine is often shortened to LX. So if you've seen LX before, that's basically shorthand for lumbar spine, and that makes it easier then when you're doing your notation when you're doing clinical notes. So rather than having to write out lumbar spine all the time, you can just put LX. And then if you're assessing different directions, you put LX ROT for rotation, EXT extension, that kind of stuff. Okay, so it helps you with your shorthand. And it's only useful if everybody in your clinic uses the same notation. So in osteopathy, see, I learnt this from the physios when I started working with physios more. In osteo, it was LSP for lumbar spine, so you might see it as that as well. But we're gonna stick to LX for this one. Right, let's just move me out of the way. I'll click there. Right, so literally stripping this right back to the beginning of learning about the vertebra and the vertebral column and all that kind of stuff. So obviously we have this vertebral column in our body. We've had a look at the sacrum over the last few weeks. And what we're just get rid of those on my screen. There we go. What we're going to do is we're going to go through all of these regions. We've obviously had a look at the sacrum and the coccyx over the last few weeks. So we're moving up into the lumbars now. Then we'll go thoracics. Then we'll go cervicals. So we'll work our way up the spinal column. But what we'll do at each level is we'll also have a look at the other anatomy that is around that region. So, for example, with the sacrum, we had a look at the pelvic floor and the organs in the pelvic floor. And when we move up to the lumbars, we'll also have a look at something called the viscera, which are your internal organs. So we will do a little bit on that as well. This is mainly a musculoskeletal course, but it's important to understand the anatomy that is around that region as well, especially if you work in a clinical environment, because there are certain parts of the viscera, so your internal organs, that can contribute to symptoms around the areas of the musculoskeletal regions. So, for example, you can have a problem with the some of the main arteries that are around that split. So we've had a look at those actually over the last couple of weeks. So the abdominal aorta, so the aorta that comes off of the heart, splits around the level of the belly button, so around about L3, into the iliac arteries. And around that region there, you can have something called a triple A, which is an abdominal aortic aneurysm. And that can present like back pain. Okay, so you need to have an appreciation of some of the other things that can contribute to symptoms. Okay, and you'll only get that if you know what other things are around that area. So when as we go through the lumbar spine, we will be kind of, if you think about it in zones, and that's kind of how I make sense of things. So if someone's got back pain, I'll think of what is in that zone. So kind of if you took a slice from L1 across and then from L5 across, what is in that region? Okay, so all of the intestines, maybe the kidneys, the spleen. You've got the appendix. Yeah, so all of those things are all in that region, as well as all the stuff we're going to cover for the musculoskeletal, so the bones and the joints and the connective tissue and the muscles and the nerves. Yeah, so we've got all those things plus all that viscera as well. So we need to have a good understanding of what's there so that we can see whether things are more or less likely to be causing someone's symptoms. Okay, so that's going to be the plan. So so we've got 32 to 34 vertebra prior to adulthood, and then once we develop, we then end up with usually 26 vertebra due to fusion of some vertebral segments. So we've seen that in the sacrum and the coccyx, where you've got fused vertebra that were separated in infancy, and then they start to then fuse together. Okay, so there's a little mnemonic down here that I just found the other day. I've never seen it before, but if you've never really studied anatomy of the spine before, then this might be a good one for you. So breakfast at 7, lunch at 12, and then dinner at 5. So we've got 7 cervical, 12 thoracic, 5 lumbar vertebra. So unfortunately it's missed out the coccyx and the sacrum, but it may be a useful way of you remembering, especially if you're doing a level 2, level 3 exam, of how to remember the different parts of the skeleton. Okay. The only problem is though, I'm going to show you something later where this dinner at 5, it might be early and it might be at 4 o'clock, or it might be a little bit late and it might be at 6. So yeah, this is typical. But there are some atypical variations as well. Good morning, Kat. Good to see you. Good to see you on the Monday morning. Cool. So we've got these different curves in our spine, and if you have a look down here, so this is the fetus. Yeah, and then as you start to develop, become newborn, and then into childhood, we start to develop these curves. Okay, so again, apologies if you know this kind of stuff, but it's useful going over it again, I think. So kyphosis is it's an anterior concavity. Okay, so where something I always remember concavity is something caving in. So an anterior concavity of the vertebral column. So a kyphotic curve is one that develops during the fetal period. So it's considered a primary curve. So if you have a look down here, this is the fetal period. So that's kyphosis. Yeah, it's like a kind of C shape like that. And then as we develop, we start developing these inward curves here. And these inward curves are called lordosis. Okay, so we've got the kyphosis from the that primary curve, and then these secondary curves, these lordosis. And the lordosis appear so as a secondary curve, and they're in the cervicals and the lumbars. So we're obviously talking about the lumbar spine over the next few weeks, and we've got we should have, everybody's different. It's typical to have a lordotic region of that lumbar spine. However, it's not a problem if someone doesn't, because everybody is slightly different. Their structures are vary, so there are variations of this of these lumbar curves. So it's important not to be too concerned if someone has an extended thoracic spine, so that or a lordotic, if you like, thoracic spine, which is this bit here, which is supposed to be curved. If that's a bit straighter than normal, okay, fine. Or if they've got a bit of a forward head here, so there's an increased lordosis in the cervicals, that can be normal too. So we would just note it down. We would pop it in a note. So I wouldn't really mention it to anybody. Somebody might bring it up. Okay, so they might say, "Oh yeah, but I've got this neck problem, so and it's because my head is so far forward," and that's not brought out in the literature. So people can have a forward head position. People can have a very steep lordotic curve, and it's absolutely fine. They have no problems whatsoever. So you can't blame pain on these curves. There's lots of other things that can contribute to symptoms as well. Okay, so that's just something to bear in mind. Something that I did want to mention here as well, and this will be really useful when we start looking at the spinal cord and something called the cauda equina. So in the fetus, the spinal cord fills the vertebral column. Okay, so it goes all the way down to the bottom of the vertebral column. And then the actual length of the cord doesn't really change that much. But what happens is, as we grow, it gets stretched. Okay, so in an adult, our spinal cord finishes at around about the level of L1, L1, L2 ish. Okay, and then the rest of it is filled with kind of like strings, basically. So bits of very thin nerve filaments. Okay, and they look like a horse's tail, so that's why it's called the chorda equina. And so it's worth just sowing that seed now, because when we get to doing the spinal cord later, you'll see that. So it's filled here and here, but then as we grow and as we develop, that spinal cord is then stretched, and the end of the cord, which was down here in the coccyx when you're a fetus, ends up around the level of L1, L2 in the adult. Okay, and that end of the cord is called the conus. That's important, especially when you have a patient come in and they've had an MRI done on their back, and you get the report, and you're expected to understand what that report means. So if you've never looked at MRI reports before, then Google some, and you can see the kind of terminology that they use on those reports, and they will use the term conus, and they'll say that the conus is in a normal position, or something like that. So you will now know what that means. So it's important to understand those bits sometimes for other things. We would never know if someone came in, if they had a different positioning, we would never know that. But if they've had an MRI report, then we would. Okay, so here we go. We're going to focus all this session on just this. Okay, so lumbar vertebra, we're going to break it down bit by bit, area by area, and yeah, hopefully by the end of this session you will know your lumbar vertebra inside out and back to front. Okay, so this is the whole thing. Okay, and you can see that there are some funky names here that you might not have heard before. So let's just go around actually. So we've got the well, that should be an easy one. The body, or the vertebral body, something called the vertebral foramen, or foramina. We've got the lamina. We've got the spinous process, the mammillary process, superior articular process and facet. Ooh, okay, and then transverse process and pedicle. Okay, and let's just have a look. So on this one, we've got a few new names. So we've done that one. Superior vertebral notch. We've got the pedicle again, the body again, the inferior vertebral notch. And you can see these notches, these create archways. Okay, and then the inferior articular facet and inferior articular process. Okay, cool. Right, so let's break down some of those names a second. We're going to have a look at those in a bit more detail. But just to help you out a little bit. So vertebral is obviously to do with the vertebra. So you know it's in that region of the body. Anything with foramen in means that there's a hole. Okay, so a vertebral foramen is a vertebral hole. Okay, so that's what that word means. Lamina is like, well, if you have a think about what lamina sounds like laminated floor, maybe. So basically, it's like thin sheets. Okay, so that's where that gets its name from. Well, that's where laminated floor gets its name from. It wasn't the other way around. Spinous processes, these are the bits that you can feel on your back. Okay, so if you, or if you've got long arms, or the bits that you can feel on someone else's back. So when you have a feel down someone's spine when they're lying on their front, these are the bits that you can feel. Okay, so you can feel these sticky out bits. Okay, so a process is a sticky out bit. We've got a mammillary process, just because of the shape of it. It's mammillary shape. And then we've got, okay, so superior means high. Articular, if you think about an articulated lorry, so it joins together. So you got the cab at the front and then the lorry bit at the back. So they articulate, and that's basically means they join. Okay, so an articulation is a join. Process, sticky out bit. And then a facet means little face, and it's basically like a baby's face, so it's very smooth. Okay, so this bit here, the higher sticky out bit that joins. Okay, so you can kind of break down the words and realize what they mean, and then the facet is it's smooth. So if you have a look over here, we've got a lower bit, so because it's inferior, that joins and it's smooth. Okay, and you can see the smoothness on in that picture just there. I'll show you some of these in the videos in a sec. Transverse means out to the side, so we've got side sticky out bits, which are transverse processes. So spinous processes are backward sticky out bits, and these ones are sideways sticky out bits. Pedicle means little feet. Okay, so if you think about a pedicure, yeah, so we've got little feet, and that's it, and then the body in the middle. Okay, so I think that's about it as a kind of an overview of the language that's used around the vertebral bodies and the vertebra themselves. This is repeated all the way up the spine. So once you know them for the lumbars, they'll be very similar for the thoracics. They'll be slightly different shapes, but they'll be very similar for the thoracics, and then very similar for the cervicals. But there are certain bits that are different in the thoracics, so that mid portion of your back, and the cervicals up in your neck, because the thoracics have ribs attached to them. So they've got special little joins around the sides here and on here, which you don't have in this lumbar. And then in the neck, we've got some blood vessels that travel up either side of the neck, go into the brain. So you have a little foramen, so two holes each side for the blood vessels to go through, and you don't have those in these lumbar vertebrae. Okay, so depending on the region they're in, they'll have different bits. So let's break this down then. So the vertebral body is the large, somewhat oval shaped, so it's kind of a bit of a squished oval, anterior at the front portion of the vertebra. So this is a top-down view. So if you were to like chop someone in half through the middle and look down on their spine, their nose would have been here, okay, back of the head here. So this is looking forwards. Can't point in the right direction on a 2D screen, okay, but forwards would be here, okay. Its posterior side, so this bit at the back here, this forms the anterior boundary of the vertebral foramen. Okay, so there's going to be all of these words now kind of mixing in together. So let's get our head around that. So this is the vertebral foramen, okay, that bit there. And this is important to understand when we look at the ligaments of the spine, because there are certain ligaments that sit here that if you injure them, they can fill this space. And at the back as well, there are some ligaments at the back. And this space here is where your spinal cord goes down. So obviously any interruption to the vertebral foramen, then there can be a compression of the spinal cord. So we need to understand the positioning of these things. So here's your vertebral body. So this is at the front of the vertebra, but the posterior aspect of the body forms the anterior part of the foramen. So that's the front part of the foramen just there, okay? The vertebral bodies of adjacent vertebra in an articulated vertebral column are joined by intervertebral discs. So, and we'll do a whole session on discs, okay? So we'll talk about that. But sitting on the top here would be a disc, okay? So if we go over to this, that bit there, there'll be a disc there, and then underneath there, there'll be a disc there. Okay, now what you might be able to work out on this picture here, there's loads of little dots in the vertebral body, and those little dots are it's called cancellous bone or cancellous bone, however you want to say it. It's basically spongy bone, and around the outside, so all that bit there, that's cortical bone. So the outside part is solid, okay, really tough. The inside part is porous, and that's really important because with the disc sitting on top, the movement of the vertebra squishing and moving around the disc, which is what they're supposed to do. They're not just supposed to just sit there. That is how the discs and the vertebra get their nutrition, okay, from movement, because they're pushing down and pulling out of the vertebra and moving around create suction forces that help the discs to maintain their health, okay, and they get it through this spongy bone. And again, when we go into the discs in a bit more detail, I'll talk about that. And it's I remember Stevie knowing what this was. There's a word called imbibition, okay, and that's basically if you imagine a bucket of water, and you have a sponge, and you just rest it on the water, it will just stay there, okay, and it will just float on the top because it's quite light. If you squeeze the sponge, put it into the bucket of water and let it go, it will draw the fluid in from the surrounding water. And that is an analogy for what happens to the disc. Okay, so when you squash a disc, which is what you're supposed to do, so don't worry about it, and then as it recoils again, it will draw its nutrients from this spongy bone. Okay, and that is how you maintain the integrity and the kind of not efficiency, but the health of the disc. Okay, so movement literally is medicine with the discs. Okay, cool. And then so same picture. Next bit, the pedicles. So if you remember pedicles, pedicure, so it means little feet. These are two short, thick, bony processes that project posteriorly from the left and right sides of the vertebral body. Okay, so they project posteriorly. So this is the back of the vertebral body just here. There's one pedicle and there's the other one just there. Okay, so if we have a look on the side view, this is important later when we start to look at the nerve roots, because that archway there, if you imagine that there'll be another vertebra underneath that here, okay, with another archway on the top, so that'll be there, that will then create a hole which your nerve root will come through. Yeah, so these pedicles, the bottom and top of them, they form the holes for the nerves to come through. All right, so that's that bit there and that bit there from a top down view. Cool. There's a good question, Stevie. Are there conditions that make the spongy interior solidify? I'm not sure whether it makes the inside solidify. It probably does, but I'd have to check. But there's a condition called ankylosing spondylitis, and ankylosing spondylitis usually affects the ligaments, and it solidifies the ligaments around the spine, and it basically cements the spine together, so you have no movement at all. That Whether it affects the inside, I don't know. It probably would, but I'd need to check. Okay, that's the only one that comes to my mind off the top of my head. There you go. It's a little research project for you, Stevie. I know definitely AS, so ankylosing spondylitis. It's a rheumatological condition where it's an autoimmune condition where the body starts attacking the ligaments that go either side of the spine, and it just solidifies the whole thing. So and it usually starts in the sacrum and the lumbars, and then they try to move, and it moves like a block because everything's solid. So that must affect the inside as well, but I don't know for sure. Okay, so that's one to check out. Cool. So the next, so we've done the body. We've had a look at the anterior part of the vertebral foramen. So the pedicles are the lateral part of the vertebral foramen. Okay, so that bit where the spinal cord goes through, the pedicles form the sides of the tube. okay, or the tubes as they go down. So the lamina are two flat plates of bone that project in a posterior and medial direction. So they go back and in. Okay, so if we have a look at where the lamina is, that's this bit here. Okay, that bit there and that bit there. And there's two thin sheets of bone, so that's why it's laminated. Okay, like a laminate floor. Yeah, so we've got these two thin sheets of bone, the lamina. And they go from the posterior side of the pedicles. So they're starting from here, okay, and then coming back and meeting in the middle here. The right and left lamina join in the midline at the base of the spinous process. So they come from there, that bit of the pedicle there, to there, on both sides. Okay, so they're one on one side, one on the other, and then they form the spinous process, or the start of the spinous process in the middle. Okay, so that then completes the vertebral foramen. So we've got the vertebral body, which is the front part of it, the pedicles, which are the sides, and then the back of it is from the lamina. Okay, so that's that bit just there. All right, hopefully okay so far. I'm going to do a few more bits and then I'll show you a video, and so it's not just me warbling on. So the spinous process, this is a bony process that projects from the posterior side of the vertebra, so at the back, we talked about that, at the midline junction of the lamina. So hopefully you're starting to get the terminology. So these are the lamina here and here, and then that's the spinous process at the back. So the two lamina come together, spinous process comes off of that. And again, these are important for later to understand where ligaments attach to. Okay, so knowing where these bits are, it will help you get your head around where the ligaments go as well. So the spinous processes vary in length, diameter, and orientation depending upon the vertebral region. So if you have a look here, this spinous process is really, really chunky. So in the lumbar spine, they're really thick, okay? And you can palpate them usually quite easily. It depends on how deep someone's lordosis is. So if you get someone lying down on their front, they're obviously going to have a lordotic curve, so it's going to concave anteriorly. And so if you want to feel their spinous processes a little bit easier, just pop a pillow underneath their tummy, and then that will bring their lumbar spine into extension, and then you'll be able to feel the spinous processes a little bit easier. Okay, so if you want to have a bit of a feel around with a willing volunteer, then you should be able to feel those quite easily. Okay, the only thing that's kind of overlaying the top of these is ligamentous tissue. Either side are muscles. So if someone's very muscular, then you won't be able to feel these transverse processes. But even if someone's really muscular, you should still be able to feel their spinous processes. Okay, so that's something that is easily palpated, although the accuracy of the palpation is usually quite poor. Okay. So the bony knobs that can be felt when palpating the midline of someone's back are the tips of the spinous process. So those are those bits just there. Okay, cool. Right. Hopefully that's all good so far. Let's have a look at this. So this is, where are we up to? Yeah, we've pretty much done all these. We'll add some more on in a sec. So we've got the vertebral body at the front. It's a bit annoying that this is flipped the other way around. I should have maybe turn the video around so it matched the images. We've got the pedicles just here, so they're coming off of the back of the vertebral body. These are the side stick out bits, the transverse processes, little faces, so these are the articular joins, so the joins between the vertebra above and below, and then the spinous process sticking out at the back, and then obviously another pedicle there. So let's have a little bit of a tour of this vertebra, hopefully. Is it going to go? Oh, no, it's not going to go. Perfect. That's bizarre. Let me just... there we go. Now it's working. Okay, so those are your transverse processes. So now we're looking at a front view. So there's the vertebral body just there. and you can see it's not just straight up and straight down, it's curved. Your lumbar vertebrae are a lot wider than any other vertebra in the body because of all of the body weight going through those lower vertebrae. So it spreads itself wider, and you can see how it tries to dissipate forces, okay, by making itself bigger. Yeah, that's why we've got a larger. Uh, oh, it's going in the right place. Yeah, that's why we've got a larger vertebral body. And then spin it around the side. So there's your spinous process at the back. So the back sticky out bit, that's the bit that you can feel. And then these are them joining together. Okay, cool. So these are some things that we mentioned right at the beginning, but not again. So these are the facet joints here and here. So there's a lumbar vertebra just there. There's what supposed to represent a disc, and then these are the little facet joints. So that will be a superior facet, that one just there, and that will be an inferior facet just there. So you can see how they all join together. Now, what's important here is the shape of the joints. So if you have a look here, that inferior facet comes down and the superior facet comes straight up. So in the lumbar spine, there is very, very minimal rotation, and it's because the facet joints will hit against each other if you try to rotate. So you'll literally get 1 or 2 degrees of rotation from the lumbar spine, not very much at all. So when you're doing your assessments and you're assessing for rotation in the lumbars, you shouldn't expect much because you can't move. It's that most of your rotation will come from the thoracic spine and your cervical spine. Okay, there'll be very, very minimal rotation through the lumbars. But what these are really good at is flexion and extension, because with the joints side by side like that, they can glide past each other in that direction, but they can't rotate against each other. So you'll get a lot of flexion and extension from the lumbars, but you won't get very much rotation. Okay. Similarly with side bending. So because of the orientation of the joints, you won't get very much side bending from the lumbar spine. Okay. So these shapes will dictate the function. Okay, and that they'll be they're different all the way up the spine. So we'll have a look at that as we go up. Okay, in fact, that was a good one there. It's really bizarre. For some reason, it's not allowing me to control it on my normal controls. Never mind. Okay, so here's those vertebral arches. Okay, and you can see the hole that they create where the nerve root will come through. Just play that again. So that, yeah, and there's your inferior facets there. There we go. Just try and pause it in the right place. So yeah, there's the transverse foramen. Okay, so the side hole. So we've got vertebral foramen down the middle. Quite often this is called a transverse foramen because it's one that sticks out the side. Okay, so that is where your nerve root will come through, and as we add on the layers, you'll see that as we go. Cool. Oh, and that that just showed the extent of the rotation. Okay, you blink and you miss it. It's literally really, really tiny, but it's able to flex and extend no problem at all. Okay, cool. Right. So that's pretty much all of what we've just been looking at. So we've got vertebral bodies, the articular processes at the top here. So these are the superior ones. So these ones up here, these are the inferior ones. And obviously the one above will attach to the one below, and then they'll glide together. And the shape of these and the way they slot together will limit the movement that's available in that lumbar spine. Cool. So transverse process. Bony processes that project laterally in a horizontal plane at the junction between the lamina and the pedicle. So there's the pedicle, there's the lamina, where they join, transverse process coming out here. And again, these are important for attachments of muscles And as we start to add the muscles on, you'll see in the origin insertion list that these are the areas where the muscles will attach. Superior articular, that's these ones here. Okay, so these are bony protrusions projecting superiorly from the site where the pedicles and the lamina meet. So we can see here, there's the pedicle, lamina will be just tucked behind it, and that is where the joint pokes out from. So we can see it just there. Okay, so it's right in the middle of that lamina. This is one that is not listed on here, but it's important to understand for fractures, because you can get something called a pars fracture or a pars defect. May have heard of those before. Very common in gymnasts, very common in cricketers, especially fast bowlers. So the pars interarticularis. Okay, so what does that mean? It means the part in between the joint. So pars means part, interarticularis is in between the joint. Okay, and it's a small segment of bone joining the superior and inferior articular processes to each other. Okay, so we've got there's the inferior process, there's the superior. So the pars inter articularis will be the bit that's in between there. And I'll show you on another image when we start to look at a little bit of pathology. But if you get a fracture along that line, it's often called a Scotty dog fracture, because it looks, if I try and create the image, so there's the ears, that's where the nose would be along there, and then that's the front paws of the dog. So if you think about the collar going across, that's where the fracture usually is across the kind of neck of the Scotty dog. And I'll get you an image for next week. But the pars interarticularis is a very common fracture in the lumbar spine. Okay, so it's something that you need to be aware of for now. Okay, and we'll add that in as we go through. Nearly there. So inferior articular process. These are bony protrusions projecting inferiorly from the site where the pedicles and lamina meet. So that's these bits just down here. So we've got superior facet, inferior facet just there, and they're coming off of the in between the pedicle and the lamina. Cool. And then the facet joints. And I think I remember saying this a few weeks ago. I used to get told off for calling them facets, but chatted to the clinical anatomist in King's College the other week, and he had no problem with it, so I liked him. You might see them called zygapophyseal joints, and they are exactly the same. Okay, so it's just saying zygapophyseal instead of facet is a bit of a mouthful. So they're exactly the same, and we've seen those joined together. So let's have a look at that. Hopefully this one will play. Here we go. Okay, so these are the joints at the back. So if we do a bit of an orientation, so there's your superior facet, there's the inferior facet just there. These are the spinous processes at the back, and then there's your transverse process there. That will be a vertebral body, and then that will represent a disc just there, just so you know where you are. And you can kind of make out the Scotty dog type shape from that side image there. Right, let's just show you this. Just move those out of the way. So this is how, move the whole thing. This is how your joints join together, okay, in your lumbar spine. This is exactly what it looks like with everything removed. So we've got, just move that across there so you can't see me twice. There we go. So usually these are covered with a capsule, and they're synovial joints. So when you move them, it helps produce synovium, and then that lubricates that joint. And that's what it looks like in real life. Okay, so excuse me, something we haven't covered, but we will do. This is the supraspinous ligament just here, and there's your joint capsule. So the joint is underneath, so the bit you've just seen is underneath there, and then there's your transverse process on the side, and you can see the holes as well where the nerve roots will come through. So it's mad how compact this area is. There is not much space for anything. Everything is pretty much full. So if you have a look as it moves, that's the movement. That's it. Okay, so the nerves will come out of there. Yeah, so those are your joints, transverse processes, there are your facets, and that's what they look like with everything on. And obviously, what's been taken off of here as well is all of the muscles. So you can see how much, well, you will be able to see as we go through the density of all the tissue that is around this area. Okay, so trying to palpate the movement of a facet joint in the lumbar spine into rotation, especially where it's 1 degree or 2 degrees, is impossible. You've got no chance. Okay, it's absolutely impossible, I would suggest. Okay, cool. So last few bits. There are some bits that are joined together to give an overall, are given an overall name. Okay, so if you have a look here, the pedicles and lamina on the posterior side of the vertebra form a U shape. So we've had a look at this already. So pedicles, lamina, pedicles. Okay, and this is called the vertebral arch. So coming off of the vertebra, we've got this vertebral arch. Now this vertebra here is a different shape to the one we've seen. So this is going to be a thoracic vertebra. It's a bit different, and the spinous process is different as well. So so the pedicles, lamina, pedicle, lamina, pedicle, that is the vertebral arch. Okay? And then the attachment of the vertebral arch to the posterior margin of the vertebra forms a large hole called the vertebral foramen, and that's that bit there in blue. Okay, and we talked about that before. So the pedicle, lamina, pedicle, plus the back of the vertebral body form the vertebral foramen, where the spinal cord will go through. Cool. Very quickly on this, because we're going to add this as we go. These are the differences between the different vertebrae, and mostly it's the angle of the facet joints. So we've already talked about this with the lumbars. So you can see here where it's just flat up and down. So they don't rotate very much, but they do flex and extend. Whereas the ones in the thoracics are shaped quite differently. Plus they've got ribs, so they'll do different things. And then the neck is different again. So you're going to get different movements from different vertebrae because of the shape of the joints. Right? And that's important to know, and we'll go through that as we go through. So you have got different joints at different parts of the vertebra. So when two vertebral columns, rather than vertebral columns, when two vertebrae articulate and when they join, 3 joints are formed. So you've got one at the front, one anteriorly, and 2 posteriorly. So posteriorly are the 2 facet joints. So there, and then so left and right facets, or zygapophyseal. And we've talked about those already. And then anteriorly, so at the front, you've got the intervertebral disc. So you've got disc at the front, 2 facets at the back. Those are the joins for your vertebra, and that's all the way up as well. Okay, so it's exactly the same. And then the type of movement occurring at the facet joints is determined by the orientation of the articular facets, so the shape of the joint of the bones themselves. Okay, so these are the movements that you should be able to do in all areas of your spine. Just move me up there. So the osseous anatomy, so the bony anatomy of the different vertebral regions dictate the amount and type of motion, and we've talked about that already. So these are the differences, and we'll explore those as we go, but flexion and extension is greatest in the lumbar. Okay, not such gross movements in the other vertebra. Okay, so we will cover those. And then we've got a few anomalies which we've had a look at when we looked at the sacrum. Okay, so remember the breakfast at 7, lunch at 12, and then dinner at 5. It's not always the case, and we did look at this when we looked at the the sacrum. So this is the sacral vertebra, but you can have similar with the lumbar vertebra as well. So in the sacral vertebra, you usually have five. Okay, so five fused together, but there can be six, four, or seven. And there are very similar anomalies as well. I didn't find any figures for them, but you can have lumbarized and sacralized lumbar spine, okay, which is hopefully this one, okay. So this bit here, that's a lumbar vertebra, but it's attached to the sacrum, and this is a bit of sacrum, but it's started to detach and become like a lumbar, okay. So there can be variations in these lower lumbars or upper sacral regions, so there can be differences. And when you're watching someone move, then or if you're doing PIVMS tests, passive intervertebral movements, you may feel that an area is a bit stiff or a bit restricted, and those regions you can feel pretty well. You can feel them open and close quite easily, but you wouldn't be able to tell which bit's which, and it may feel restricted because they've got a sacralized lumbar potentially. Okay, so these are the classifications for the lumbar vertebra. So we had a look at the sacrum before. I'm not going to go through these in any great detail. Both non-pathological, Tristan. Yeah. There is no good evidence that it causes pain. Yeah, it's just different. That's all. Yeah, that's a really good point. Yeah, you may notice that someone is just a bit more restricted, but what usually will happen is they'll adapt, and other areas of their spine will be moving a bit more than what you would expect from somebody else. So it's basically horses for courses. It's everybody's different. I tend to think that different people different structures lend themselves better to different activities. So, for example, if you're very kyphotic, so you have a very kyphotic thoracic spine, you tend to be a better cyclist in terms of like Olympic level. If you had a very extended spine, you'd struggle getting down into that aerodynamic position. So just it wouldn't stop you from doing it, but you probably wouldn't be elite. Yeah. So having that bone structure helps you compete, and that's why we have these different body shapes, different body types that suit different activities. By all means, you can do different activities, but you might not be world class. So it's just the way it is. So these are all the different types of lumbarization or sacralization of the lumbar. So we've got lumbar vertebra that are joined to the sacrum instead of being free. So usually there's a disc in between L5 and S1, but sometimes the transverse processes of L5 will stick to S1. Okay, the promontory of S1, so it becomes sacralized. Right, yeah, sometimes it's both sides, sometimes it's one, but it's just stuff to be aware of. These are all the different anomalies. Okay, cool, and that's it. Lumbar spine. What time is it? Blimey, 50 minutes on the lumbar spine. So I told you, just that. Okay, we'll take all that time. So what's a really good thing to do? Just get rid of that. Really good thing to do is if you can detach some vertebra from if you've got a skeleton at home, then you can kind of draw on little bits or label them up, color them in, and then you start to revise things from the different sections. The Complete Anatomy app is really good because it's got a bit in there where it's done exactly that. So it's kind of shaded in different sections, so that and then you can copy that and then do that in your notes to make sure that you know which bit's which. But hopefully now that all makes sense. Okay, so you've got all these little bits in there, and as we start to layer things on, especially the ligaments, and I'll refer back to MRI reports again and again because you will hear these names being talked about all the time on those reports. So you'll start to understand the terminology now used on MRIs. Okay, cool. Have a good Easter Monday, what's left of it, and I will see you next Monday at 10 o'clock. Cheers, guys.